Imagine being told that the key to overcoming your debilitating mental health struggles might lie in a medication that was once considered a dangerous party drug. That's the reality facing patients and doctors alike as they grapple with the potential of ketamine, a powerful anesthetic that's quickly becoming a controversial player in the mental health world because of the promise that it could break the cycle of depression in a matter of hours. Sounds like a miracle, right? But what exactly is ketamine? And why does it share a nickname with a cereal marketed towards women who want to lose weight? Today, we're jumping into the wild world of ketamine in psychiatry, a medication that had me super skeptical because I kept seeing ads for shady clinics popping up all over the internet and kept receiving email after email begging me for referrals for this revolutionary treatment. But that all changed once I started to offer the FDA-approved Esketamine at my office, and guess what? Saw life-changing results. Mind blown, right? But who am I? My name is Salman Aziz Mirza, triple board certified in adult psychiatry, child and adolescent psychiatry, and addiction medicine, and you're not going to believe what I have to say about this one. So, let's talk about ketamine and how it's being used in psychiatry. Ketamine is a medication that's been around since the Vietnam War. Originally used as a dissociative anesthetic, the type of medication used to put people to sleep during surgery that also helps them not remember it, and with some pain control as well. But in the last several years, doctors have started using it to treat depression and other mental health problems. Now, you may be thinking, wait Dr. Mirza, I learned in middle school health class and the award-winning J-Lo movie Hustlers that ketamine is A drug that people use at raves and techno clubs, and B, a drug that's given to Wall Street playboys to knock them out so that strippers can run their credit cards for tens of thousands of dollars. Yes, these are both true. Ketamine's effects can be misused, like any substance, which is why it remains a Schedule III controlled substance by the DEA. But when it's used under a doctor's supervision, it can actually be really helpful for some people with depression, especially those who haven't gotten better with other treatment. The unique thing about ketamine is that it works differently than a lot of other antidepressants. It targets a different part of the brain, the NMDA receptors, and it seems to work faster too. Some people start feeling better within a few hours or a day instead of weeks or months like with traditional meds. And the results aren't just anecdotal. Studies have shown that ketamine can quickly reduce symptoms of depression, even in people who have tried other treatments that didn't work for them, and can be effective in those with acute suicidality as well. It's also been looked at for things like PTSD, OCD, and anxiety. Now, it's important to remember that ketamine is not a miracle cure. It doesn't work for everyone, and it does have some side effects, like feeling spacey or disconnected for a little while after you take it. But for some people, it can be a real lifesaver. Of course, if you're thinking about trying ketamine treatment, it's super important to talk to a doctor you trust. They can help you weigh the pros and the cons and figure out if it's right for you. But overall, it's pretty exciting to see a new tool in the fight against depression and other mental health struggles. So yeah, ketamine is kind of a big deal in psychiatry right now. It's giving hope to a lot of people who have been struggling with depression and feeling like nothing will ever help. And while it's not perfect, it's definitely a promising option for some. Before you click on the first Instagram ketamine ad you see, let's dive into the differences between non-regulated ketamine clinics and FDA-approved esketamine, also known as Spravato. It's super important to understand what sets them apart. First off, non-regulated ketamine clinics use a mixture of two ketamine enantiomers called R-ketamine and esketamine. These are given to patients through IVs, shots, or even as a nasal spray or under-the-tongue drops. The crucial thing to remember is that the FDA has not approved ketamine for treating any mental health issues. So when these clinics use it, they're doing it without the FDA stamp of approval. On the flip side, esketamine, commonly known as Spravato, is an FDA-approved nasal spray that uses the, wait for it, S-ketamine enantiomer. It's been given the green light for treatment-resistant depression, an insurance term referring to depression that hasn't gotten better with at least 2 or more other meds. Plus, it's approved for adults with major depression who are having suicidal thoughts or actions. But here's the key difference. You can only get Spravato at certified healthcare locations that monitor you for at least 2 hours after each dose. That's because it can cause some serious side effects like sleepiness, feeling disconnected, and even the potential for misuse. The FDA has put Spravato through a ton of testing to make sure it's safe and effective when used the right way. They've got a special program called REMS, or Risk Evaluation and Mitigation Strategy, that make sure patients are monitored closely to catch any problems early on. What that means is that after every administration, I have to fill out a form and send it to the FDA, or else I get yelled at. Sorry, Spravato Rems. With non-regulated ketamine clinics, there's just not the same level of oversight. They might use different doses or forms of ketamine that haven't been studied as much. Plus, patients don't have that same safety net of being watched by medical professionals for a couple of hours after treatment. That means there's a higher chance of side effects or even misuse. So while both options aim to help people struggling with mental health, it's crucial to weigh the risks and the benefits. Spravato has the backing of the FDA and a system in place to prioritize patient safety. Non-regulated ketamine clinics, while they may offer some hope, come with more unknowns and potential dangers. Ultimately, it's all about making an informed choice with the guidance of a trusted mental health provider. So how exactly do these non-regulated ketamine clinics work? Well, the process can vary quite a bit from place to place. In general, you'll start by having a consultation with a doctor or a nurse practitioner. They'll ask about your mental health history and see if ketamine might be a good fit for you. If you decide to go ahead with treatment, you'll typically receive a series of ketamine infusions. This means the drug is given to you through an IV in your arm. Each session usually lasts about 40 minutes to an hour. You'll need someone to drive you home afterwards, since ketamine can make you feel pretty out of it. And driving home like that, well, probably not the wisest choice. Now, let's talk money. Ketamine treatment at these clinics isn't cheap. It can run you anywhere from $400 to $800 per infusion. And most people need at least 6 sessions to start. Insurance usually won't cover it either. So you're looking at paying thousands of dollars out of pocket. In comparison, FDA-approved esketamine treatment tends to cost less in the long run. Even though it's still pricey, more insurance plans will cover at least part of it. Plus with esketamine, you know you're getting a regulated drug in a controlled medical setting. Which brings us to the risks. And there are quite a few to consider with ketamine clinics. First off, since these places aren't regulated, there's no guarantee of the quality or dose of ketamine you're getting. It could be too much, too little, or not even pure ketamine at all. There's also the risk of serious side effects. Things like high blood pressure, disorientation, blurred vision, nausea, these can all happen with ketamine. And if the clinic staff isn't properly trained to handle emergencies, that's a scary thought. Another biggie is the potential for misuse. Ketamine is known to be habit-forming, especially at higher doses. If a clinic isn't careful about screening patients and monitoring them closely, misuse could become a real problem. And when we mix in the fact that the business model for a lot of these clinics is to get people in the door and stick an IV in them, it gets a little dicey when we start adding the lure of repeat customers and a guaranteed payday. So while the promise of fast relief from depression can be super tempting, it's important to weigh the risks. Choosing an unregulated ketamine clinic over an FDA-approved treatment like esketamine is a serious decision. Also, there's still a lot we don't know about the long-term effects and safety of ketamine for mental health, as compared to the decades of research and data we have on standard antidepressants, or interventions like ECT or TMS. Rushing into treatment without all the facts could end up doing more harm than good. So, take your time, do your research, and don't be afraid to ask tons of questions with a qualified mental health professional who has your best interests in mind. Your health and well-being are worth it. If you're thinking about ketamine for depression, there's definitely some important stuff to keep in mind. First off, like I just mentioned, we don't really know the long-term effects yet. It's still pretty new in the world of mental health treatment. Some studies have followed people for a year or so after treatment, and it seems like the benefits can last a while. Some of my own patients have been getting Spravato treatments consistently for years now since it was approved in 2019. But we need more research to understand how it might affect people over many years or decades. There's also the question of how often you might need treatment to keep feeling better. It's not like you just do it once and you're good to go forever. You might need boosters every few weeks or months to maintain the positive effects. And of course, there's always the potential for side effects, especially with repeated use over time. We know that about 20 to 30% of those who use ketamine consistently experience bladder or liver problems. Ketamine isn't a magic bullet, but it's a promising tool that could help a lot of folks who are struggling. The key is to approach it with eyes wide open and make an informed decision that feels right for you. It's your mind and body on the line, so don't rush in without doing your homework first. And remember, no matter what path you choose, you've got support out there. Keep pushing forward, one step at a time. If you learned something new today or have had experience with ketamine, let me know in the comments below. Personally, I'm a believer in Spravato, as I have seen my patients do tremendously well on it, achieving stability with remission of depression for the first time in years, as well as being able to reduce, if not get off, most of their other psychiatric medications. At the end of the day, it's a discussion for you and your doctor, and I'm not your doctor, unless I am your doctor, of course. Either way, don't forget to like, subscribe, share, and comment, as your engagement keeps the content flowing and going. Until next time, be safe and be well.